talking to a few people earlier that it was in October of 2022 that we actually announced the beginnings of this endeavor. And it was colder that day than it is today, by the way. Remember? And then we had the groundbreaking. And I just have to reminisce. I do have talking points, by the way, Cass, that I'm not going to look at. That there are so many people who have been behind this endeavor, and for all the right reasons. You know, I can't even begin to remember all the meetings we had every week, sometimes multiple times a week, to think about what's the right place, what's the right thing to do, where do we want to go, why do we want to go there? And you know, when everybody was going to the west side, we said, no, we're going to go to the east side, because that's where the community needs us, right? And when we understood the fact that more than 75% of the community actually lives on this side of the interstate, right? Then we started looking for a piece of land and said, let's find a piece of land that's big enough that'll house this amazing place as you see it, and as you will get to see it. And the piece of land we found was beautiful. It's beautiful in front of, you know, the river. And it wasn't easy to actually build on this piece of land. So we never did anything that was easy. And part of that is because of the mission and the vision of who we are as an organization, and the fact that doing the right thing is absolutely important to Froedtert ThedaCare and to all the people that are here. It takes a village. We were just talking about this earlier, that, you know, without the community, without the city, without the chamber, without a whole host of people who actually helped us to think this through and to bring it to fruition, this would not have been possible. And I'm super proud of our Froedtert ThedaCare team members, particularly those in the North region who envisioned this, who worked tirelessly, both the clinicians, the nurses, the techs, the leaders who work day and night to make this a reality. And the beauty of it is actually going to come once we open the doors and have people come in, because that's what we're here for, right? So our work is really important. We are here to advance the health and well-being of our communities. We do that by virtue of making sure that we are providing excellence, and we are providing it through discovery, making sure that we are learning new things, and inspiring each person to live their unique best life. And why that's important is because we don't want to be paternalistic or maternalistic about what you need, but we want to partner with you to make sure that we do what is best for you. That's different, I would say. The other thing is it's a great responsibility. Froedtert ThedaCare now has, this is our 20th hospital. We are an $8 billion organization. We have over 28,000 people that work at Froedtert ThedaCare. We have 360 different clinic sites that we work out of, and we take care of more than 2.8 million people in the state of Wisconsin. So when we think about that, when I think about that, I know Lynn thinks about that, and many in this room, we think of that as a great responsibility, because every patient, every member of the community, every family is a responsibility that we take seriously. So we want to make sure that they have fun. We want to make sure that they heal properly. We want to make sure that we care for them properly. We want to make sure that we do it in the right way. And that we do it in this beautiful building that also helps to create the space of healing. So I'm super proud, I'm super thankful, I'm very appreciative of everybody who's been able to come together and allow us to be here today and to have this impact in this community. These kinds of things are generational. This is going to be here forever and ever and ever. And it's going to be a game changer, I hope, for this community. It inspires a lot of other people to actually do things that make this community a wonderful community, even better than what it has been up to this point. So I'm going to call upon our leader in our North region, Lynn Detterman. She's our president, to come up and say a few words.
So I wasn't planning to use my script either, Cass, but Dr. Andrabi said all the things. But just thank you for being here today. I've had the blessing of being part of this project from the beginning. And to be here today, to see it all come to fruition, it's very humbling. And half of the audience, I think, are emergency medicine physicians. So just know you are all in very good hands. But I do want to tell just a few little stories. So when we decided that we were definitely doing this project in Oshkosh, we had wanted to come to this community in a different way. And we were all really excited. But picking the property was a big responsibility and a very big step. And I think I saw Cheryl Berg somewhere, and she was the one that came up with this piece of property. We were looking at the Piggly Wiggly, we were looking at all these different places in the community, and Dr. Andrabi said, we wanted to be where the community lives and needed us and needed that access, that convenient access. But Cheryl found this piece of property and we said, yes, this is it. First of all, we have 2 other hospitals that we built along rivers, and it's just the way we roll at Froedtert ThedaCare. We like to build along the water. But we thought that would be a great opportunity to partner with the Oshkosh community in their economic development. So yes, we wanted convenient access to healthcare, but we also wanted to be a catalyst on this side of the river for future economic growth. And so we're just really excited for that partnership with the city, and it came out beautiful, right? Every detail of this facility has been well thought out, even the artwork. A lot of effort went into artwork of, people reacting to, no, that doesn't make me feel like it's a healing environment. And so just know that every detail was thought through carefully in order to provide just a great experience for our patients and their families. So it's a big day. I will pass it on to our next leader, Jenny Nicolai. When we were building Fond du Lac and Oshkosh, we knew we needed to find the right leader, someone who could really work with the community and really just make this these 2 facilities exceptional. And we were so happy when Jenny applied for this position, and she was our immediate yes. She's the one. So I'm going to invite Jenny Nicolai, our Vice President of not only Fond du Lac, but also our Oshkosh campuses.
Thank you, Lynn. It is so great to see all of you here today, a full house. Couldn't be more excited. Thank you. As Lynn noted, when we were developing plans for this health campus, we really took the time to understand the needs of the community. We know today in Oshkosh, as Dr. Andrabi mentioned, nearly 73% of the population lives east of Interstate 41, whereas most of our healthcare services today are west of 41. And what that means is that our community east of 41 is potentially 15 minutes or more away from an emergency room or a hospital when they need care. And we all know that when you have an emergency, minutes count and time matters. And that's why I'm really excited as part of this health campus that we can provide emergency care here when and where you might need it. When we were choosing this location, Lynn alluded to this as well, we were really thoughtful in the right location, the right spot in which we wanted to expand the services in this community. And this site was vacant due to soil conditions. Many of you in the room are familiar with this. And so there were various factors that impacted how we would develop, how we would design, and how we would construct this building, including the history of this area and what was on this campus beforehand. So we worked with many stakeholders. We worked with the Department of Natural Resources, and once we had a plan developed, really powered by our commitment to improving the health and well-being of the communities that we serve, we were full speed ahead. That approach that we took not only allowed us to create this incredible campus that you see in front of you right now, but it also allows us to think about the needs of the community today, as well as the needs of this community into the future. And that's really a testament within Froedtert ThedaCare of our efforts to keep care local, close to home, when and where you need it. ThedaCare Medical Center-Oshkosh is designed to provide comprehensive care 24 hours a day, 365 days a week, 365 days a year, 7 days a week, with a focus on pursuing innovation in healthcare. And that really allows us to ultimately create value for every single person that walks through our doors. In total, the health campus is about 114,000 square feet and an investment of over $84 million in this community. Our initial services include 24/7 emergency care and inpatient care, lab services and outpatient surgery, primary care, pediatrics, and specialty care, as well as drive-through retail pharmacy, and imaging services including CT, X-ray, ultrasound, mammography, MRI, and nuclear medicine. To adapt to the changing needs of the community, we did, through our planning process, add a third floor to this medical center, and that really allows us the flexibility to quickly expand based on the needs of Oshkosh. As the leader of the new health campus, I look forward to improving the health and well-being of the Oshkosh community. Thank you again very much for being here. Next, to discuss more about emergency care provided here at this campus, I'd like to introduce Dr. William Comfrey, Associate Chief Medical Officer of Emergency Medicine and Emergency Department Physician at ThedaCare Medical Center-Oshkosh.
So I will try to use a little bit of what Cass provided, unlike those before me, sort of. So I will be working here. I'm a board-certified ED physician, and I will be working on site. I also oversee all 10 of the ThedaCare EDs, and I also work at Fond du Lac, so it was great because we started there, and this is very similar to Oshkosh, which was a huge help. So I want to start with one of the reasons I am super excited to be here in Oshkosh. I'm a Wisconsin boy. I went to Marquette, went to Medical College of Wisconsin, so near and dear to my heart is the state of Wisconsin, but I also grew up fishing, hunting, water skiing in Fremont on the Wolf River, and took some of those trips back and forth to Lake Winnebago, where my friend from medical school, his dad lives on Black Wolf Point. And during those trips, God blessed me with putting me at Fratello's for a beer after a water ski trip, where I met my beautiful wife. And she was an Oshkosh student, so she also loves this community. And she was living in the River Mill condos. So we go back there every year to Fox River Brewing in July on our anniversary, and so we absolutely love this area. Now with 5 kids that we homeschool, we also come here and continue to celebrate all of the great things Oshkosh has to offer. We all know about the AA, but the Wapaka boat ride that outgrew Wapaka and now is in Oshkosh. Oshkosh is the biggest, grass volleyball tournament in the country. Very cool if you haven't been there. Also the Life Fest Music Festival, one of the biggest music festivals in the country, is here. So we continue to really enjoy the Oshkosh area, and we love this area. It's near and dear to our heart. So getting back to why we are here, the new campus. The new campus, with this magnificent community hospital, there is a designated emergency department entrance over there. We have an 8-bed ED, in addition to other areas that support our staff as we care for patients. When you have an emergency, as Jenny was saying earlier, minutes matter. In those instances like chest pain, stroke symptoms, trauma in particular, time is critical, and it matters. At this site, similar to Fond du Lac, we will see you fast, like a snap, like a finger snap. For those data geeks out there, this is pretty fascinating, but a snap reaches peak rotational acceleration of 1.6 million degrees per second squared, 10 times faster than a blink of an eye. So sometimes we see people that fast because we're standing there waiting for them. But in reality, objectively, we can look at our Fond du Lac site, and we've been seeing people on average, median time, within 3 minutes, which is really unheard of. I don't know where else you can go and be seen within the first 3 minutes, but it's pretty astounding. And one of the things to maybe bring it more real to all of us human beings is that's how long it takes you to get your Starbucks, or as Wisconsinites, to down a bratwurst. It's about 3 minutes. I looked it up. It's a fact. So refocusing, I'm an ER doc, so kind of, little ADD, but refocusing, our teams here are prepared to teach each person, no matter their condition. We staff with our own local board-certified emergency physicians. That is who you will see each and every time, a board-certified emergency physician every single time. Next, we as a team can stabilize each person and provide the care that is needed. Looking at our other new location, we've been able to care for the vast majority of people at the site locally. I think we transfer out less than 5%, which is on par or better than all of our existing established EDs. And if a higher level of care is required, we work within our comprehensive system to get people to the right location. That's one of the many benefits of being connected to an integrated healthcare system, is that we are prepared to care for the whole person. Our physicians, nurses, and teams were intimately involved in the design process of this beautiful site. It was imperative that we included their valuable insight because collectively, I think we were talking earlier, and right as we were speaking, Dr. Zifferblatt walked up, and there were 4 ED physicians there, and we were on some of those calls. And collectively, we have over 100 years of clinical experience, which is pretty cool. And they're all just kind of sitting out there. So with that, I remember those sessions. There were 3-hour sessions, and we passionately discussed every single detail, from the size of the trauma bay, which obviously is important, to things that didn't really seem super important, but like, the shape of the sink in the patient room so we could face them, and where the call switch was most appropriate so we weren't getting in the way of the patient if we needed a call for a nurse. It was a great spirited collaborative effort, always with the patient and family at the center of that. The ED layout is focused on patient safety and quality, something ThedaCare has received multiple national awards for as a top decile performer. The team's workstation will be located in the center of that, and the patient rooms are kind of, you'll see, to the perimeter, so we have a direct line of sight into each room. With that, the physician kind of sits in the center, and it's really cool. It's kind of like a big family because it's the ED physician, and then the ED nurse, the inpatient nurse, and we kind of sit with lab and radiology and imaging, and we all just kind of sit together as one big family, so we communicate really well. Frankly, I think we have, the latest and greatest technology, equipment, and space to provide patients with the very best experience. So our teams are truly honored, blessed, and ready to care for and serve the people in this community, and to live what Hippocrates championed 400 years ago before Christ, not years ago, 400 BC. To cure sometimes, to relieve often, and to comfort always. So thank you, and of course, go Pack Go. So next, I'd like to introduce Rebecca Grill, City Manager, City of Oshkosh.
Thank you, Dr. Comfrey. I look forward to learning more about you and meeting your staff, but hopefully it's not after I eat a bratwurst in 3 minutes. We're incredibly grateful to have you here serving our community and providing care when and where it is needed. And thank you to the entire ThedaCare team for your ongoing commitment to the Oshkosh community, not just as a place to deliver medical services, but as a community to invest in, grow with, and stand behind. We are proud to attend events like this, celebrating the accomplishments of change makers and community builders. This campus aligns with the redevelopment and revitalization efforts in the downtown, riverfront, and throughout our city neighborhoods. We're seeing new housing come online, employers expanding, young professionals choosing to plant roots here, and businesses leaning in because they like what they see: opportunity, potential, and a community worth continuing to build a future in. This hospital is part of that story. It's proof that when innovators, partners, and community builders work together, the results are real, lasting, and felt for generations. This positively supports the entire region. Strong health systems support strong economies. Strong economies support safer, healthier, and more desirable communities. So today, we celebrate not more than a ribbon cutting. We celebrate partnerships, investments, and leaderships in the community. It is truly exciting time for ThedaCare and Oshkosh, and we are deeply appreciative of the investment in our community. And now I'd like to welcome Lynn Detterman back to the podium to close out the program. Thank you.
All right, are we ready to see this place, right? Excited? Okay, so we're gonna invite all of you to go outside. You have to go through that maze of the ropes, okay? And if you can figure that out, go outside, and we're gonna do the ribbon cutting in front of the emergency department. And then we're going to show you this beautiful building, and we can't wait to show it to you. So thank you everyone for being here, and we invite you to head outside.